Well, the all-party parliamentary group was set up to look at child loss and really to have a number of aims. So to increase awareness, to try and improve the bereavement care pathway, including around training for medical staff, but also support for parents once they've left hospital. To look long-term at some of the issues around research and prevention. So quite an ambitious agenda, and one where we're unlikely to achieve everything in our first year, but we've certainly made some progress. It's been important to me because I lost a child. I lost my child Sam, my son Sam, in 2009, and actually for many of the members of the group, they've also lost babies or children as well. So we are all MPs and Lords that have personal experience of child loss, and therefore we come at it both as members of Parliament but also as parents. Well, we're trying to work with the Department of Health to look at a bereavement care pathway. We know that there's a lot of confusion in hospitals and trusts, and perhaps a lack of knowledge in clinical commissioning groups about support that is needed for parents. And luckily there's been some funding from the Department of Health, and that bereavement care pathway is being developed. And we want to spread knowledge about that. We want to make sure that medical professionals know about it, that they can feed into the process, but more importantly, that they help deliver it. It makes a huge difference. I think one of the things that I was really shocked to discover was, for example, that as part of their standard training, midwives only get sometimes 1 hour of bereavement training, if that. Now, how can you support parents if you've had so little training on what you're supposed to do, and it's as part of something that may, part of a number of modules? And the reality is it's quite common. We know from the numbers there are 200,000 miscarriages a year, there are 3,500 stillbirths or neonatal deaths. The figures are poor in the UK, and staff really need to be trained, and it's not just midwives, it's nurses and consultants. And if they are properly trained, kindness and compassion and approaching parents in the right way can make a huge difference in how the parents feel after they've left that clinical setting. It's things like not constantly, staff not being aware that a baby has died, so they'll come into a room and say, "Oh, how's your baby doing?" and things like that. It's being told what the sources of support are after you've left hospital. I was left in a plain room with no windows on a sofa for over 3 hours on my own, with no means of communication, because I'd left home in such panic I didn't have a phone, because I was being told I had to wait for the police. Actually, I should have been offered, could I have can we organise a cab to take you home? I had a child at home on their own with a relative stranger looking after them, and I wanted to get back. And it's common sense and kindness, and I would say it's really important that professionals look at the pathway that hopefully will be introduced and follow that, because that will give the clear guidance of best practice. And there are a lot of hospitals out there who are really good at best practice, but there are a lot that are rubbish at it. And it's really about sharing learning and not having to reinvent the wheel.